Hey, welcome back to the Morning Brew here on Thursday. It's Breast Cancer Awareness Month, as I'm sure some of you know. We're going to make you a little more aware today. I want you to meet Dr. Stephanie Fine. She is on the breast cancer team at the UNM Cancer Center, and Dr. Fine happens to be a New Mexico native.
Lobo.
You're a Lobo and a New Mexico
Exactly.
native and everything.
Exactly.
You're from Tesuque?
Yeah, I grew up in Tesuque, Santa Fe,
Nice.
kind of left and came back, and I'm here to stay. I'm not moving again. I love New Mexico.
Oh, it's great. We're
So,
glad you're here.
Joined the Cancer Center this summer.
Everybody that works at the Cancer Center or has been a patient there just talks about how world-class it is. And,
Truly.
And I know you can testify to that.
We have an amazing team. We have, first of all, the setting is incredible. They did a really nice job with building a cancer center that I think everyone feels comfortable with. It kind of enveloped in beautiful art, and just the setting is really nurturing. So immediately you kind of feel comfortable, and then you start meeting your team. And a breast cancer team is actually quite extensive. There are a lot of people that are going to help you through the process of getting treated.
It's good to know. Now, when you were in medical school at UNM, did you gravitate to this kind of work? To the
surgery.
oncology?
I didn't know I was going to be a breast cancer specialist then, but I love surgical disease,
right.
and that's what I went into. And then, very common in today's medical practices, you kind of develop a niche and eventually do a fellowship in more specialized work. So breast cancer is my passion.
Good.
And, yeah.
I think you have, with breast cancer in particular, you have to be, there's an extra layer of compassion that has to go with that as a provider, right?
You are absolutely right. We spend, excuse me, probably more time on the average, talking with our patients and trying to really get a sense of where they are in the process and how we can meet their needs. That's not something I think that you find in every interaction between a surgeon and a patient for, say, gallbladder disease, for example. But we take a lot of time, and it's important that our patients feel like we're listening to them and we're their advocates.
Yeah, that's so beautiful. And let's talk about the football game.
Okay.
First of all, the Lobos are going to be playing tomorrow night against San Diego State, and it's the Lobos Love Pink game.
Exactly.
And so you being a Lobo, you're qualified to talk about this.
Second official year, I do believe, of
There's Lucy.
the little here's Lucy, and we've got our beads going, and it's about wearing. It's the awareness that we're trying to generate, with this game. October is Breast Cancer Awareness Month, and we will all be there in our, pink this and that, and the coaches will wear pink, and the players will wear pink.
Yeah.
And then in the halftime, there is a special performance honoring both patients who've had breast cancer, as well as those who've lost that battle. So we'll all take a moment to, remember them and celebrate their lives. And
there'll be a lot of survivors there being honored.
Exactly.
At halftime.
Yeah, I think
That
you're going to
must
see
do
a
your
lot
heart
of
good.
pink, and a lot of women, maybe more women in that crowd than
That's wonderful.
what the stadium is used to seeing.
That's wonderful. What can, I'm speaking from a male perspective here. What can the men do to support their women better through this process?
Ask them, have you had your yearly mammogram yet? When are you going to schedule that? Because detection in the early stages of the disease is how we get the best results, not by waiting until something is actually, you can feel a large lump there, or there's some other symptom or change that you're noticing. We really advocate that early detection. That's where we get our best numbers. And you can't find those typically with your hands, with your fingertips. You got to have a mammogram. So we still advocate age 40, starting at age 40, and in some cases, some patients might need an earlier start than that, depending on individual characteristics. But we still believe in annual mammograms right now. At some point in the future, we might be able to target groups of people, especially the women who are in their 40th decade. we might be able to say you could go every other year and
Right.
you need one every year, but we're not there yet. We don't know
Okay.
who those people are.
I see.
So we want to get everybody screened.
Now, family history matters on this too? Just like
Absolutely.
heart disease and diabetes and other
Exactly.
things like that.
And that, you know, when you have a family history of breast cancer or ovarian cancer, those are the two main red flags that will alert us that you might be a higher risk patient. And you might be someone that needs an earlier start, again, on mammography. Or you might be a candidate even for genetic testing. Most places who are doing mammography, screening mammography, have this kind of screening process in place now to identify higher risk patients, and they'll let them know.
We had a mammographer on the show yesterday.
Okay.
And she talked about how what they're looking for is as small as a grain of rice.
Exactly.
That you can pick that up, and that's the ideal time to catch it. Because
Absolutely.
that patient can be treated much better than
There
something
is
more
no
advanced.
way you're going to feel that. You are not
Yeah,
going to feel
it's
that.
not gonna
You're not
happen.
going to have any symptoms. The only way you're going to catch that is by getting a mammogram or some other type of imaging. But we all, you know, screening mammograms are a standard part of, you know, breast care.
Yeah.
They do not, we don't recommend, for example, doing ultrasounds without a mammogram, or people ask a lot of questions about breast MRI. How come I can't have a breast MRI instead of a mammogram? Those other things are complementary to a screening mammogram. The function of that test has not changed, which is that it's the best test to screen a whole bunch of people and get the, you know, the most accurate results for a large population.
Now, you mentioned symptoms. Besides feeling it, are there other symptoms as
Absolutely.
the cancer advances that you see in patients? What are
Nipple
what is-
discharge that is bloody
Oh my gosh.
really should be attended to
That's
immediately.
get
That
to your
is
doctor
a get
right
to
away.
your doctor right away. Things like any skin changes. I recommend that women actually lift their arms up in front of a mirror when they're doing their monthly exams and look for any skin changes like puckering or indentation. Sometimes the nipple becomes inverted. If you see any redness of the skin, any scaling kind of
Those
you
are
know,
all
little,
signs.
yeah, things that, or maybe it could be a pigmented lesion, you know, that appears on the nipple. That needs to be looked at. Anything that's different or new about your breast, you should bring to the attention of either your family practice or your, you know,
Yeah.
primary care doctor.
The good news is the technology is so much better now.
Absolutely.
The treatment is so much better, and there are more survivors than ever, right?
I think people don't realize that when you lump everyone together, say stage 1 through 3, we actually have a greater than 70% cure rate.
Wow.
Just overall.
That's
then,
wonderful.
then when you take it down to stage 1, it's in the 90s. You know, we have a huge success rate with breast cancer, and we're getting better all the time.
I bet your patients love you. You're really a great person.
Thank you.
It's
Thank
great
you.
to meet you, Stephanie.
Thank you very much.
Dr. Stephanie
Enjoy
Fine, well, she's on the breast cancer team at the UNM Cancer Center. It is Breast Cancer Awareness Month. Lobos Love Pink game tomorrow night at the University
7:30.
Stadium. Wear your pink. Go out and cheer them
Absolutely.
on. Thank you.
Let's see all the ladies out there.
Yeah, you bet.
Thank you.
Great to meet you. Thank you. Dr. Stephanie Fine on the Morning Brew. We'll be back with more after this.